Assalamu alaikum, hello and welcome to Care Across Cultures. I'm your host, Mirban Hussain. You're listening to us on Link FM 96.7. We're also available on DAB and online Facebook. This series of programs is around mental health. And today we're tackling a subject that affects every community and still remains hidden behind closed doors. Last week we talked about children's mental health. This week we'll be talking about adults' mental health. The silence in mental health costs lives, damages families, leaves people suffering alone. And that's a sad thing because there is help available, lots of help available. Joining me today is Dr. Sridhar Reddy, a consultant psychiatrist working in adult mental health services. Now, like Dr. Hayat last week, Dr. Reddy and I have been friends for many, many years. We work together, and I'll be introducing you to, we lovingly and affectionately call him just Dr. Reddy. So I'll be introducing him to Dr. Reddy in a moment. But Dr. Reddy sees firsthand how stigma, cultural beliefs, misconceptions prevent families, individuals from seeking the support that they desperately need. Over the course of the programme, we'll be breaking down myths, challenging harmful beliefs, but most importantly, we'll be opening up a conversation that could change lives. Before we begin, a quick disclaimer. The views and opinions expressed by our guests today are their own and my own, and not necessarily those of Link FM or of the organisations that we represent. Another thing that I need you to know is that this is a pre-recorded show, so please don't ring in or text. And I know what's going to happen this week. Because it's pre-recorded, people are going to ring in and they're going to send text message, but please don't. Dr. Reddy, thank you so much for being with us today. How are you?
I'm fine. Thank you, Mirban. Thank you very much for inviting me to this very important discussion regarding the mental health.
No, thank you so much for taking some time out, because you guys are really busy, aren't you? Yeah. You're very busy.
Not so busy that we can't serve the community. So.
That's great. You remember the first time we did this before, didn't we?
Yeah.
BBC Radio Sheffield.
That's right. We did about the dementia.
We talked about dementia, didn't we?
Yeah.
And that's when you were over at Kendry Hospital as well, and I was working for the Alzheimer's Society.
That's right.
That was a really good programme.
Yeah, thank you.
Yeah, that was a really good programme. So, Dr. Reddy, help us understand what mental health actually is. Okay? Many people confuse everyday emotions, sadness, with mental illness. Where do we draw the line?
Yeah. It's a very, very important question you did ask about what does it mean by mental illness. Mental illness, for example, a person is physically unwell. He has got all the symptoms, isn't it? So, and he's not able to perform to his best because of these symptoms. So in mental illness, similarly, a person will experience symptoms such as feeling low in their mood, the feelings, feeling low in his mood, or acting differently, or thinking differently. These are the symptoms of mental illness, and it becomes illness when it is affecting that person. Mainly is functioning. If he's not able to function to his potential, or if he has deteriorated in his functioning in the sense he's not able to do his job, he's not able to maintain his friends or social life, or he is not able to attend to his personal care or his needs, that is where it is termed as mental illness.
So these things actually manifest as physical things, don't they? Maybe sleeping, not eating, or maybe drinking too much.
Yeah,
those kinds of things.
These things do happen in people suffering from mental illness. Because, for example, if somebody is struggling with severe anxiety or some unnatural beliefs or some perceptual abnormalities, means hearing voices or something on those lines, they are floridly psychotic. They are not able to sleep because sleep is affected, and they may engage in drinking alcohol excessively, sometimes to dampen the symptoms. Or it can work both ways. If somebody is using illicit substances to dampen the symptoms, but these illicit substances seems to trigger those symptoms as well.
Right, okay. So it doesn't really help then. So help. You're depressed, for example, and then, I don't know, you start drinking alcohol, maybe a glass of wine, yeah? And then, but that glass of wine, because one's never enough, you might have a bottle. And then does that then cause more sort of depression?
Yeah. Alcohol is actually seen as depressant.
Right.
So drinking alcohol doesn't help. It actually worsens your condition, mental health.
Right.
So it's not good to drink alcohol first thing. And if they are drinking alcohol and that they have got mental illness, it's going to get worse. The symptoms are going to get worse.
So is it just alcohol or is it drugs as well, smoking? There's all these kinds of things that we hear about, aren't there?
Yeah, all of them.
Yeah.
All of them. For example, smoking increases the anxiety symptoms, and it can have effect on your physical health. So you will struggle to cope with mental health. Physical health and mental health go hand in hand. So if you're smoking and then you have got damaged your lungs or you have got poor physical health, then it's not going to help your mental health.
And what about food, Dr. Reddy, in terms of, because there are people who eat too much or people who, don't eat at all. And then we've got two extremes, haven't they? Because they potentially might become obese and get diabetes and various other issues, or they become so sort of, they're not eating at all, become so thin.
Yeah.
Is that part, can that be a part of mental illness as well?
It can be. It can be part of mental illness. For example, people suffering from eating disorders. As I mentioned, that some people eat more, some people eat less. Or people may struggle to eat. So people with anorexia, they may find food as food as a difficult subject altogether.
Right.
And they will be worried about the calorie intake and they are scared that they are going to gain weight.
I think I'm going to stop you there because we're going to pick up this later about current social pressures.
Yeah.
So from your experience in adult psychiatry, which mental health condition are the most sort of common ones at the moment?
The most common psychiatric illness is anxiety and depression. Okay. These are the two commonest illnesses in the mental health. And another thing is that they vary in the degree. For example, people might suffer from mild, moderate or severe depression.
So let's step one back and say, okay, anxiety. What is anxiety?
Anxiety is a fear.
Fear.
Is fear of unknown.
Okay.
So people may develop fear or fear in the sense thinking that things will go wrong or thinking something will happen. There is no evidence of those things happening, but you are thinking that they will go wrong or something will happen, and then you develop these symptoms such as palpitations, sweating, or panicking, or like phobia is also part of anxiety, where, for example, if you're fearing of going and being targeted in social circumstances, that you avoid going into the social situation. So that is called phobia, avoidance behaviors.
Right.
Or generalized anxiety. For example, getting worried about each and everything. Well, like Your husband is at work and he is traveling back, you're worried that he may not turn up, or he may meet with an accident. Or children going to the school, you're worried that they may fall ill. So you may not be able to succeed in your life. Or these type of, it's called generalized anxiety.
And generalized anxiety disorder, GAD as it's always known. So what about depression then? When does anxiety become depression, or am I on the wrong path?
No, both of them can trigger each other.
Okay.
So people with severe anxiety, prolonged anxiety, untreated anxiety, they can present with symptoms of depression. They go hand in hand again. So depression is a mood disorder.
Okay.
In this, depression means your mood is going low.
Okay.
So if a person feels consistently or predominantly low in their mood for 2 weeks.
Only 2 weeks?
That is the minimum.
Is that the minimum?
Minimum, okay. So 2 weeks, mostly low in their mood, they are feeling, and you have observed that they have been feeling low in their mood. Along with other symptoms of depression, like loss of interest, feeling poor in motivation, struggling with concentration, all the other symptoms like sleep disturbance, weight loss. If you have got all those symptoms of feeling hopeless and worthless, then we know it's a depression. And it can range from mild, moderate to severe. And some people who are very depressed, they can present with psychotic symptoms.
Okay.
Like people suffering from severe depression may believe that their internal organs are rotting.
Really?
Yeah. And they are not fit for anything. Or they may believe that people don't like them.
Okay.
So they may develop this type of delusional beliefs, or they can hear voices. So those things can happen. But usually they start with mood symptoms and then they develop psychotic symptoms.
Is that because it remains untreated then?
Pardon?
If they don't see somebody, if they don't seek help for the depression or the anxiety which has become severe, and that then may become something more?
Yes. If people don't seek help in the initial stages, or if they don't recognize that the symptoms what they are experiencing are a mood disorder or depression, because in our community we don't tend to see clearly that we are suffering from low mood. What we tend to see is, let us go along, like we have to struggle, we have to do something. We just push that back.
That's part of who we are, isn't it?
Yeah.
When I talk about the South Asian community, I'm talking about the Indian subcontinent.
Yeah.
So Pakistan, India, Bangladesh, all of those sort of areas. And
that's
there
true.
is this understanding that we have that we have to do this, no matter what.
No matter what. So what will happen is you just generally neglect it, saying, okay, fine, I'm not feeling well today and I will be fine. I will do something, but you're not able to address the issue there,
the key issue
that you have got depression, and then you need treatment for the depression. So
the danger, Dr. Reddy, is that first of all is that we may not understand the symptoms and the signs, because we may not have that knowledge and understanding.
Yeah.
And secondly is that even sometimes when we do recognise that actually I'm very tired today, my heart's not in doing this today, I don't really want to go to work, but because of our sort of value systems, for want of a better word, or because of the needs of the family, we just carry on.
Yeah, that is what I mean. Like, although you've been feeling low, depressed, poorly motivated, you have lost interest, but still you push yourself for your family without realizing that you eventually things will get worse. So when you feel that way, it's better that you speak to the family or go to your GP, seek help, and address the issues which is leading to you feeling depressed.
And I suppose that if it's sort of just starting out, there must be sort of quick remedies, prescriptions you can give, or if you go to your GP, for example, say that this is how I've been feeling. If I go to my GP and say, look, this is how I'm feeling, I feel really low on this. What would could a GP do for you in the first instance?
Yeah. It's a multiple options are available.
Right.
One is talking therapy.
Yeah.
And second is medication.
Okay.
Medication and talking therapy together do well. There is more evidence that they work together better than working individually. So talking therapy, like CBT, cognitive behavioral therapy.
Right.
So you can be referred to a talking therapist who can then do an assessment how these symptoms have developed, what may have led to you experiencing these type of symptoms, and how to manage the situations better. So you'll have better understanding.
Because there's always a root cause.
Yeah, there's always a cause.
And there's always a cause.
Yeah, there is always a cause for, and on the medication side, there are many medications available which cause less side effects. Although all the medications do cause side effects, but there are many medications. If you are not able to tolerate one medication, there is a choice of.
Yes, that's something that I think the majority community don't realise that.
Yeah.
Like you said, all medications have some side effects.
Yeah.
But just because, for example, you've been given amitriptyline, just because that doesn't work, just because it hasn't helped you, doesn't mean that that's it. You need to go back to your doctor and say, well, this is how it's affecting
That's important, isn't it?
Yeah.
Like if you're not able to tolerate amitriptyline, there are other medications like sertraline, citalopram, fluoxetine, paroxetine. There are many.
So many.
Yeah.
So many.
And mirtazapine.
Yeah.
There are multiple choices for you to try.
Okay.
And one of the medications may suit you.
Yes. And I think this is a key point where I've learnt over the years that it's a trial and error with medication, especially with SSRIs, as you mentioned, with anxiety, depression medication, because we're all built differently and medications all affect us differently, and it's really important that we do sort of make sure that we take the medication, because one of the things I found also is that people have told me over the years that I had 2 tablets and I couldn't wake up for 2 days and I've stopped taking them, which is defeating the objective, isn't it?
Yeah. So some people, there might be some truth in the story as well, that they have taken medication, they are new to the medication. We don't know if they have taken only antidepressant or antipsychotic or something else, like anxiolytics, like diazepam and all. Yeah. They do cause drowsiness and make people feel sleepy. But if you are experiencing such side effects, rather than stopping, it's making an appointment with the GP, discussing your side effects. Yeah. Because if you're not tolerating the medication, at least it can go on your medical records that you have not tolerated the medication. So the GP can then look at different medication for you. So rather than you taking the decision, I would recommend that you speak to your doctor.
Speak to your doctor. Yeah. I want to have a chat very quickly before we go into a break, that in many, not just South Asian families, but many sort of communities across the world, there is this belief that mental illness brings shame to the family, or it's a spiritual failing, you've committed a sin or something like that, or that it's black magic. Okay, these are sort of 3 key things that I keep thinking about. Where do you think this thinking comes from, based on your experiences, and what harm could this kind of thinking actually cause?
In my opinion, that thinking may have come from different areas. For example, mostly a person who has committed a crime was incidentally diagnosed with mental illness, and then it may have circulated in the community that people with mental illness are at risk of harming others. Like people we may have seen in our community as well back in India, like people with mental disorders are neglected and they are on the road. So the mental illness may have worsened and they may engage in some odd behaviors. So that may have put that picture of that person may have triggered our thoughts that they are intensely dangerous, but that's not the case. People with mental disorders are not excessively dangerous or very dangerous to other people.
In general, there will be cases obviously where there will be
one or
like everything
cases,
else.
And people without mental illness as well. So you can find that they also do commit crimes, isn't it? So that's one thing. Actually, people with mental disorders are more vulnerable to get harmed because of mental illness.
Because there's something about capacity, isn't there? Because if you're suffering from mental illness, you haven't got capacity. You're not aware of the decisions that you're making or of your actions.
Well, it does happen that people may lose capacity. Most of the people with mental illness do have capacity when they are well in their symptoms. When they are really unwell, there is a possibility that they may take some decisions which are not in their best interest or best interest of other people.
Okay, we're just going to go into a break. So if you've just joined us, you are listening to Care Across Cultures. With me, your host, Mehban Hussain. I've been talking to my wonderful friend, Dr. Sridhar Reddy, consultant psychiatrist for adults. We'll be back shortly after this break. Welcome back to Care Across Cultures. You're listening to us on Link FM 96.7. I'm your host, Mehban Hussain. I've been having a conversation with Dr. Reddy about adult mental health. So we were talking, Dr. Reddy, specifically about, where was I? Yeah. We were talking about people who get confused around, I've lost my spot now. This is what happens when you have a bit of a break. Mehban loses everything. Okay, not to worry. So we were talking actually about, we'd started talking about shame, spiritual failings, and even black magic. Okay. And we're talking about where does this thinking come from? And you mentioned about, from previous sort of cultures, traditions, that kind of stuff. Now, what harm can this kind of thinking actually cause in terms of if people believe that it's a spiritual failing or it's black magic? Would they actually then not come and see psychiatrist and not seek treatment because they may then go and seek treatment from someone else?
That is the real risk, isn't it? In our communities, we have got this concept of black magic, and what will happen is it'll delay the treatment, delay help seeking, and it'll increase the distress to the person.
Yes. And
prolonged untreated mental illness can cause more damage to the person suffering from the mental illness. and once they receive the treatment, I think it will be longer they have to be on the treatment because the symptoms have gone untreated.
And there's also another danger, isn't there? Because with the medicine, psychiatry, this is rules and regulations, laws, organisations, that if something goes wrong, you can do something about it.
Mhm.
And doctors like yourself have gone through rigorous training, and there are guidelines, and they're accountable that you can only do X, Y, and Z and within certain parameters.
Mhm.
But if you go and see someone, I don't know, a faith healer, for example, or someone who claims that, I can fix this black magic that's happened to you, what are their sort of qualifications in terms of, do we know?
See, this is a very first of all, I don't think they understand the mental illness because they have a very different outlook to the mental illness altogether, isn't it? They think that it is because of some sins or something, which I don't think is the right way to understand the mental illness and the symptoms of the mental illness. And also it's going to, as I mentioned earlier, it's going to delay.
So eventually, yeah. So they can try all these things.
Yeah.
And then, from what I've heard and from my research, it costs a lot of money, these treatments, don't they? These alternative therapies, for want of a better term.
Yeah, that's true. I mean, first of all, as I mentioned earlier, the families, they may have poor understanding about what is causing the mental illness, and then they're going to these faith healers.
Yes.
They may take advantage.
Yes.
Financially, and they may exploit the family and the patients as well.
Right.
Because the patients are more vulnerable as people suffering from mental disorders, like severe mental disorder. They are more vulnerable, they are more suggestible, and there is a risk that these type of healers may take advantage of people suffering from mental disorders. Yeah.
Thank you for that. I want to move on now and talk about... Excuse me. I've got a bit of a chest infection, those who are listening, so my apologies. Stigma I want to talk about. Stigma is a very powerful force, and you've come across it many times. And I just want you to talk a little bit about stigma, and as a factor which stops people from seeking help. Because people are so worried about judgment from other people. And one of the things that I really want you to focus on also is that this is not just to one section of society. Yeah? Across society, there are these sort of feelings and understanding about stigma, and people get really worried about it. And what I'm hoping that what is a sort of a psychiatric, answer, if you will, to stigma.
See, stigma towards the mental illness is always been there, and it is across all the communities, and some communities more, and some communities it is less. Mostly towards the west, it is less because people started looking at the treatment. People may have started seeing the benefit of taking the treatment and getting better. But in other part of the world, like eastern side, where I come from, I think people hesitate to get the treatment or hesitate to get the discussion going on about the mental disorder or mental illness, and openly talking about the mental illness. That is not there in towards India or Pakistan, that side of the world. But here, people are more open to discuss about the mental illness, the symptoms they experience, or that will help them to seek advice or seek proper support from the mental health services.
So, what do you think that, as as organisations, you as a psychiatrist and mental health services, what do you think that we could do about getting rid of the stigma, or what is being done?
So I think the stigma of mostly it is a poor knowledge or poor understanding of the mental illness or mental disorder is the reason for the stigma.
Okay.
Many people may believe that somebody having a mental disorder in the family, thinking that he is danger to the surrounding community or family members, or people start distancing from the family and they don't want to marry their girl into the family.
Yes.
Thinking that the mental disorder will be inherited. So all those things can increase the risk of stigma. So education around the mental disorder, how this mental disorder tend to happen in people, like how, why do people suffer from mental disorder, what could be the reasons. We till now we don't know any concrete reason why it happens.
Right. Okay.
You can't blame the person who have got the mental disorder for having the mental disorder. Do you understand what I mean?
Well, because Dr. Reddy, if somebody has, breaks the leg, yeah, and the leg is in two pieces, they're not going to go and alternative medicine. They're going to go to the A&E, aren't they?
Exactly.
Yes, that's where they're going to go. And this is, I always struggle to understand this. That if you've got cancer, for example, and I'm not saying that prayer doesn't help, because it does. It does, but alongside the treatment as well. Yeah. If you've got Parkinson's, for example, lots and lots of the, you don't if you get, influenza, you go to your doctor to get, treatment, don't you?
That's right,
Yeah. And we don't think about that at all, do we? But when it comes to mental health, we almost seem to say that, I don't want anybody to know.
Yeah. And what happens is, as I said to you at the start itself, like people will just neglect it. Oh, right, fine, I'm not weak, I want to be strong, this is not going to affect me. And they will just go along, go on with their life without realizing that things can get worse over a period of time. So it's detecting early and seeking help early matters.
Right. Now, I want to talk about some of the challenges that we have today. We all have challenges, but I want to talk specifically about the people from the Indian subcontinent who've either come to live in this country or maybe were born in this country. And workplace demands, money worries, loneliness. Yeah, there are so many of these. And I'm asking you to look at your practice. Which of these are most worrying to mental well-being?
I think difficulty in integrating into the society, or not diversifying, or feeling scared, and workplace pressures bullying, not only workplace, like when children are going to the school, or if they have experienced negative um, um, moments that can affect the mental health.
Okay.
Um,
Let me ask you a different question now. Without naming any names. Okay. So someone gets admitted to a adult psychiatric hospital. Okay. What's going to happen? The process. Okay. Help us understand that, because I've spoken to many people outside in the communities, and people are so afraid and scared that these places are somehow very fearful and they don't want to know about them. But so let's go through a step-by-step process of what we can expect in general.
Normally people don't come into the psychiatric hospital straight away. Like there are other options, like having treatment at home by the home-based treatment team, or many people with mental disorder may not require admission to the hospital.
Okay.
But people requiring admission to the mental hospital, there are few reasons for that. One is that they are presenting risk to themselves or risk to others, or risk of further deterioration, because they are not taking the treatment for the mental disorder, and the mental disorder is severe that they can't, the symptoms or mental disorder is severe that they can't manage this person safely in the community. So that is the reason that they are coming into the hospital. Or patients may choose to come into the hospital saying that I can't cope in the community, I need to come into the hospital so that I can have my treatment done properly.
Right.
So it is quite a daunting experience, because you are away from the family, you are away from your home, and you are in a hospital, that on a ward with many other people having different psychiatric disorders.
And some very ill people as well.
Some quite very ill people.
Yes, some very seriously ill people.
And it can be quite a difficult experience, because you are there, you are surrounded by people who you don't even know, and they are suffering from mental disorder, and there is a risk that they can be aggressive towards you. So, and then you are in a room on your own, with the nursing staff available if you need any help.
So as a consultant, when would you get involved? Say a patient's been admitted.
Well, usually what happens in our workplace is that I as a consultant get involved within 72 hours of patient getting admitted.
Okay.
Usually once the patient comes into the hospital, they are clocked in, or the initial part of the assessment is done by the doctor, ward doctor, resident doctor. And if there are any emergencies, like physical emergencies or something like that, we'll arrange all the blood tests, and we can liaise with the general hospital to treat that condition. But if there is some psychiatric emergency, like somebody is very agitated, aggressive, then we look at various ways to de-escalate the situation and help the person to alleviate his symptoms, mostly by giving some medication as well. And if he is presenting very, very high risk to others, then we can put him in a place where it is much more quieter, secluded.
So my understanding is that within a psychiatric hospital, a mental health hospital, there are two parts. There is the general part, and then there's an intensive unit as well. Okay.
Intensive unit is for the people who are very distressed because of their symptoms and because of their experiences, because their mental illness is so severe that they are presenting high risk. So in intensive care, what will happen is there will be more nursing staff, more people to help them, and they can be put in, or they can be placed in an area which is more secure for
Okay.
them.
So they can't sort of get out of it, or
They can't sort of get out of that, but the staff is always there to monitor them. If they are, they want anything, like any needs they have got, the staff can fulfill the needs for them.
So I'm getting pictures now, and I'm wanting to ask this question for the audience. I'm getting pictures of these films that I've seen, where these are padded rooms. Yeah. Is that what we're talking about? Is that what they look like?
The seclusion area is not like padded room, but seclusion area is as I mean, the name itself is secluded area.
Okay.
So seclusion is secluded area. So where somebody is floridly psychotic, they are very distressed because of their mental illness symptoms, and they are very high risk to others.
Okay.
There is a risk that they could harm others. What will happen is, for their own safety and safety of others, the person is
Kept
placed in that, kept in that area, and they are treated. Once they are treated, once the symptoms are better, once the risks are reduced, then we tend to see them and then get them back into. It's not that they want to do the things intentionally, just to keep the person in that seclusion area. We regularly review the patients, and if they feel that the risks are reduced, then we can get the patient.
So it's very similar to a physical illness,
Exactly.
as in a hospital, general hospital. So maybe you've had an operation.
Yes.
For example.
For example, if you are in coma,
Yes.
or you had an operation,
Yes.
if you are physically very unwell, then you are going into ICU. Once you are treated, then you are coming out.
So you stay in ICU because there are more nurses, there are more doctors, and you're being monitored all the time.
Yes.
So that the slightest thing changes, you can be treated very quickly.
Yeah, that's right. Yeah.
So it's no different then to a physical intensive care unit where a physical illness is treated to where a mental illness is treated. Right.
So it's similar to that.
Okay.
But people with mental illness, they are quite scared, they are quite afraid, and it can be quite difficult for them to understand what's happening. So it
Someone
might
in
be a
the
terrifying experience.
someone in the community asked me to ask you this question. That when a family member of theirs, and this is some years ago, was in an intensive unit within a psychiatric hospital, they weren't allowed to see them and visit them. But from what you're telling me, if it's very similar to the ICU unit for a physical illness, because you're not allowed to see them there, are you, either? Or is that changed? I don't know.
This is a very difficult question to answer. The reason why they are not allowed to see the person when somebody is in seclusion is basically that person is quite distressed.
Okay.
And they are presenting risk. Like if they open the seclusion room, they may attack people.
Okay.
Or they may harm themselves. Or they may try to leave the hospital.
Okay.
And you don't want the relative to see all these things.
Right, okay.
Once they are more settled, they can see the person. But if the relative insists that they want to see, there's no harm in arranging with the staff to go and see the patient. But usually seclusion room is within the unit.
Right.
And when they are very unwell, it's quite distressing.
So it's a bit safeguarding for the family members as well, isn't it? Yeah. If that's your loved one who's going through a very ill time.
Yes.
And do you really want to see them?
Yeah.
Going through all of these? Yeah. Because I think one of the things that I think perhaps some members of the general public don't understand is that doctors have a duty, not just for the patient, but also for the family members as well, to try and keep them.
Yeah.
Because it's like, You see it on TV all the time, don't you, where a loved one's been hurt and is rushed to the ambulance and the A&E, and they're wanting to go in, and the doctors stop them, and the nurses, no, you can't go in because we have to do it. So it's that kind of thing.
Yes, that's true.
It's nothing else. Okay.
So anyway, they say whatever is like, the misconception is that, oh, my patients are not getting treated, they're getting harmed. That's not the case. No. Or in NHS, I can definitely say.
So you're not hiding anything. No, you're not hiding anything.
We are accountable for everything,
yes,
and then we are responsible for the care of the patients, and we only work for the betterment of the patient.
Yes.
That's it.
Okay. So we are getting close to sort of the end of the programs, but there are a couple of questions I needed to ask you. Okay. So someone who's listening right now, who recognises that they're struggling, okay, with their mental health, what would you advise them to do as a first practical step? What could they do after watching this?
It is important that if you're struggling with something, that you speak to the family member.
Okay.
If you're married, you might be having wife, and then you can speak to them about what you're going through. And if you've got friends, you can speak to them. Best thing will be to go to your GP, discuss about what your experiences are, and why you're struggling, what's happening, and then the GP will guide you.
We'll take it forward
from there.
As I always say on this programme, it's always about the first point of call is always your GP.
Yes.
But what I also wanted to say is that sometimes people find it very difficult. And if there is someone else in the community, perhaps your next door neighbour is a nurse or a doctor, or somebody works, for some kind of organisation. Go and have a chat with them as well.
Yeah, I think that's the most important point. That is what I was saying.
Yes.
First, go and discuss.
Go and talk to somebody. Somebody that you trust. It might be your brother, sister, might be your neighbour.
Yes.
Do not suffer in silence.
No.
That's the thing, because the key thing I think from today is that there is definitely help and support out there. Now, I did have lots of other questions for you, but we are sort of, we've reached the end of the programme very soon. So, Dr. Sridhar Reddy, I can't thank you enough for your time today and for being so honest with us, because these conversations really save lives. And to everyone listening, thanks for being here and for listening with open hearts.
And thank you, Mirban, for the opportunity.
You're welcome.
Thank you, everyone.
I really hope that whoever's been listening will share what you've learned with other people in their lives. And remember, key things that asking for help isn't weakness. It's actually one of the bravest things that you could do. And when we speak up, as Dr. Reddy said earlier, we're not bringing shame on ourselves or our families. We're bringing hope. You've been listening to me, Mirban Hussain, on Care Across Cultures with my dear friend, Dr. Sridhar Reddy. And join us again next Tuesday at 11 o'clock as we keep talking about things that matter. You've been listening to Care Across Cultures on Link FM 96.7. Until next week, Allah Hafiz.